Welcome to Mountain House Health Matters. My name is Bryan Harrison. I am the publisher of Mountain House Matters and your host for this episode of Mountain House Health Matters. Today we have with us the dynamic duo of Dr. Chitta, a pediatrician from Pearl Pediatrics, and we have Dr. Chitturi from the Assure Primary and Urgent Care here in Mountain House. And we've got a good subject for you guys to gain some information on. We are going to be talking about allergies versus upper respiratory infections, or URIs. Exciting stuff, good stuff you should know about, because how many times have you felt like maybe you're getting sick, or is it just allergies? Hard to know. So we're hoping to enlighten people on what to look for and how to treat it. I think I will pass it off to you, Dr. Chitturi. Welcome.
Hi, Bryan. Hi, Dr. Chitta.
Hello.
Hi, Dr. Chitta. Thank you for being here with us. This is great.
Well, it's my pleasure.
So today we would like to focus on very common topic regarding the allergies and upper respiratory infections. There are quite a few differences between the both, but both diseases have so many overlapping symptoms. So it's very difficult for patients to know when to go to the doctor or what kind of over-the-counter medications they can take in case of those symptoms arise. And we have a subject expert, Dr. Chitta, who is a pediatrician, and she can give us some tips on how to handle these issues in kids.
Especially for kids.
Especially for kids, yeah, because that's more adults can manage it somehow or the other, but parents get very nervous when the kids get these kind of symptoms. All right, so I have drafted some questions for Dr. Chitta so that she can share some information for us. Are you ready, Dr. Chitta?
Of course, anytime.
All right. So, Dr. Chitta, one of the common questions that parents ask us, especially when they have a rash. So, many viral infections develop rash, bacterial infections develop rash, and at the same time it can be allergic reaction too. How do you differentiate between an allergic rash or infectious rash?
Yeah, that's a very interesting question. And it's very common. In this season, we are seeing a lot of children presenting with various rashes. The first thing I look at it is, a rash when it comes, is it only in a certain area of the body, or is it on the entire body?
Right.
That helps us to differentiate. If it is like only on certain areas, especially the areas where you are usually getting in contact with something, like when you go for a walk, when you're hiking or doing something, you are like grazing on some grass while playing soccer, things like that.
Like poison ivy.
Mm-hmm. Yeah, and you see rashes in those areas. Mm-hmm. It's likely allergy to something that you're coming in contact with it. Mm-hmm. And also you would see some itching. Itching is one of the very important sign that suggests it's probably likely from allergy. Again, some infectious rashes can also have itching, but it is less often. Allergic rashes are mostly itchy. A lot of people might also know that hives, which are like red little bubbles kind of things that you can see all over the body usually, and they're spread almost evenly everywhere on the body. That is how you can differentiate allergic rashes.
Those are usually from an allergy?
Yes, usually from
an allergy. That can be
allergy.
stress-induced as well, though, can't it?
The urticaria, yes, the hives can be induced by stress as well.
So hives are usually smaller in the area and raised lesions from the skin and can be itchy. And when it's infectious, usually it's more firm to touch and tender. Yeah. That's one of the differentiations.
Yes.
I guess whether or not it's infectious would be the key thing to look for and to determine whether or not parents need to worry if siblings are going to get an infection.
Exactly,
Right.
whether it is contagious or non-contagious, that is the most important thing to differentiate. Mm-hmm. So usually if it is associated with infection, some of the viral infections also can develop those small red color slightly raised lesions all over the body. Some of the common upper respiratory infections will have those kind of rashes. There are other rashes like a little bit more vesicles, little fluid. They turn into ulcers, they scab over. Those are like hand-foot mouth disease. That is a contagious disease. So we have to differentiate like that. Hand-foot mouth disease, a lot of parents are aware of that. You will see some ulcers inside the mouth, inside the throat. A lot of times these upper respiratory infections and other viral diseases, they are associated with other symptoms like cough, congestion, runny nose, or fever. Fever is one of the important factors that can differentiate infectious etiology.
All right. So one more common symptom that patients develop is cough. Especially during this time of the year, patients go out for walking. Like when they go out for walking, when they have pollen allergies, they return home coughing and wheezing. So is there anything that you look into in the type of cough that differentiates between allergic cough and like a pneumonia cough?
Yeah, okay. So if it is related to allergies, it's mostly observed during like when they go to the bedtime and it is time for bed, or first thing in the morning when they wake up, they would have cough. The cough that is associated with mucus. It's most probably the allergy induced. Cough from infections or the upper respiratory infections or pneumonia, all of these would present with cough. It can be dry, it can be with mucus too. But for children, they always do not produce the sputum out. So you don't see anything coming out, so you think it's a dry cough. But it is actually a wet cough. We can feel some congestion in the chest, congestion in the upper respiratory tract, which can lead to cough. And this cough is usually the same throughout the day. It can be on and off depending on the hydration status of the child, depending on the activity. It can change. Also, it can associate it with some trouble breathing. The trouble breathing, again, allergies, allergy-induced asthma, that's a different kind of trouble breathing where you can notice wheezing that can happen. Younger children, they can sometimes have something called croup. Croup is more like a hacking cough. It comes as a sudden bout of cough. They have a good spell of cough for a few minutes and then calm down. That is called croup.
It kind of has its own sort of tonality to it too, doesn't
Right.
it?
Yes. And if that kind of cough is noticed, that's a sign that the child needs to be taken to emergency right away, because they need to get some kind of breathing treatment that cannot be prescribed. It has to be administered only in the hospital. So that's how we can differentiate croup.
So that's a
cough.
pretty extreme example, but are there simple ways that parents can tell the difference, whether it's a wet cough or, I mean, they don't all have a stethoscope, so.
Right, yes. So, okay, as I said, wet cough can be infectious or can be allergic too. Usually, if it is mild cough that is not bothering your daily activities, you're just coughing a little bit here and there, you can take some over-the-counter cough medication and observe. But if it is persisting, especially if it is persisting more than 5 days, that is something that we need to look for. Or if it is associated with a little bit of trouble in the breathing, or the cough is so severe that the child is actually throwing up. That severity is also a sign that, okay, something that we need to get checked. Yes.
In fact, I'm glad that you mentioned about the over-the-counter medications for cough. Is it safe to give over-the-counter cough suppressants to kids?
So not all cough suppressants that are in the shelf are okay. We have to differentiate, especially under 2 years of age. I would say no cough medicine at all under 2 years of age.
That's important to note, like 2 years and below, no cough medicine.
Yeah, absolutely.
cough
So what do you
medicine.
do for little 2-year-old or under kids, babies that are coughing?
So we need to diagnose the underlying condition and treat the underlying condition, what is causing the cough, and that's how they get better. So for these young children, cough is actually a protecting mechanism for them. When they're coughing out the infection that they have or the virus that they have. If we are suppressing, it actually is stuck inside and worsens the problem.
You're not helping.
Yeah.
So cough is a
That
symptom,
why-
it's not disease. What she's saying is like you need to treat the disease, right?
Yes.
Than the symptom, especially for young kids.
Right.
Yeah. All right. Okay, Benadryl. So everybody probably has Benadryl at home. Is it
Okay.
safe for everyone to take Benadryl?
Wow. Yes, very good question. Very important. Yes, we always say, okay, keep Benadryl at home. You get an allergic reaction, give Benadryl right away. That is what we say. But again, we do not want you to give Benadryl almost every day for a cough or cold. Benadryl is a very strong antihistamine. It is sedating, but it can also suppress breathing center for young children.
Oh, really?
Yes. So I do not suggest giving Benadryl under 6 months of age. 6 months to 2 years of age with caution. If it is a very acute allergic reaction where like the lot of rashes on the face is swelling up, but the breathing is not affected and they are able to swallow, that is only when the Benadryl can be given. If it is like milder allergic reactions or the seasonal allergies like runny nose, little bit of congestion, I would suggest doing other antihistamines like cetirizine over the counter. Those are my preferences rather than Benadryl.
So do you have any suggestions in case of acute allergic reaction? What kind of first aid do you suggest for the patients?
The acute allergic reaction, it's mainly that presents like these hives. Only the hives, I would say, treat with some oral medications, especially the Benadryl. And we have to make sure that we are doing weight-based dosing.
Right.
I suggest everybody to contact your doctor whenever you go for well visits. Talk to your doctor about age-appropriate dosing for Benadryl that you can keep handy and do only that dose. We do not want to overdose because of the respiratory suppression. Again, if we are underdosing, it is not going to help. So that is very important to know weight-based dosing.
I was going to ask you if you should just start with a small dose to see if that's enough for them. But if it's too small, that's not good either.
Yes, so that's not. The other precautions or other first aid measures that can be taken is make sure we check the breathing status of the person or the child. It is very important. The children, they look like they're fine, but they deteriorate very suddenly. The signs being if there is any lip swelling, tongue swelling, eye swelling, the eyelid swelling, those are the signs. Go to ER right away or any urgent care nearby if the breathing is.
If they have that type of swelling or even in the throat, does Benadryl help that?
No, we do not want to do Benadryl at that time. They can get choked on
'Cause
the
that
oral
could-
medication.
Huh.
So only for the skin rashes, I would advise Benadryl.
Huh.
If there is any lip swelling, tongue swelling, throat swelling, eye swelling, that's a sign to go to ER.
Is there something you can do before you get them to the ER that would alleviate some of that? I mean, if the throat is swelling especially, and they can't breathe.
911. Because we cannot
Hurry
do
up and get 'em
anything
there.
orally. Yes, we will be worsening the problem. So, if anybody has EpiPen handy, like if they have a history of allergies that are diagnosed in the past and EpiPen is available, EpiPen can be administered right away.
I guess that's the go-to these days.
EpiPen is like a
Yes.
shot
Yeah.
in these kind of cases. So to summarize, the warning signs would be like trouble breathing, choking sensation, face swelling. Then you need to go to the hospital immediately.
Yes.
All right. So this
Good.
was an interesting question that one of my patients asked. Their kid had a blood test which showed multiple allergies. What to do? Their allergy, like in the allergy test panel, they had like 5 different allergies. So how do you handle those patients?
Yes. Yeah, that's another common thing that we face, because when we see a lot of children going through these allergies and being very safe in the school, especially they are worried about sharing lunches, touching others' foods and getting allergic reactions, a lot of parents would come and like, oh yeah, we want to get checked for allergies. Can we order those blood tests? Yes, sure, we can do the blood test. But the problem with the blood test is it's very unreliable, the results. You can have lot of foods or environmental allergies. You can test for everything. There will be like 40 or 60 things that can be checked. All those things that we see as positive reaction in the test result, the serum based test results, in real life the child may not be actually having a physical reaction on exposure. The blood test will only tell us that okay, the body is sensitized to that particular allergen. That means it is sensitive, but it need not develop a reaction.
So the potential is there, but they might not actually suffer from it.
Yes. In some situations, the test can be negative, but they may actually develop a reaction when they're exposed to something that came as negative in the blood test panel. That is how to differentiate. So
they're not very
advise they are not accurate. Please do not go with the blood testing for allergies and unnecessarily restrict the child for some of the things that they could be okay eating and enjoying. Also, not to have a false sense of protection that, oh, I'm not allergic to these things because the test is negative. I would advise if there is any particular concern about allergies, like the hives, where some child is getting hives very often, almost every day or 2-3 times in a week, and we are needing to do this Benadryl or some other allergy medications very often, or the child is needing multiple courses of steroid medications to treat these allergies. Those are the signs I would say, okay, I think it's better to go for allergy testing with an immunologist, where they do a skin testing. Like on the back, they poke multiple things, about 40, and look for the skin reaction. Those are more,
So that's more accurate.
Yes, that's more accurate. The skin testing is advisable. Also the same for the food allergies. If there is any concern for food allergies, see the immunologist, get the skin pricking test. That's the best.
Okay. So we often prescribe steroids for kids with severe allergic reactions depending on the assessment. Is it safe to use steroids in kids?
Yes. Okay. So steroids, in general, some parents, they are very worried. As soon as we say steroids, oh my God, that's so strong, we don't want to do with it. I'm very concerned that that can potentially alter the growth of the children. I heard that children may not grow taller if we give steroids. Those are the usual questions that I usually hear. The steroids, when they are used in a age-appropriate weight-based dosing and in the short term, very few days, like 3 days, 5 days, or as prescribed by the provider in a tapering course over 3 weeks. Initially, they would do a little bit normal therapeutic dose, and then the dose is gradually decreased over the period of few weeks. That way, the body's hormonal balance is not disturbed with the steroid medication. As long as the steroids are being used according to the provider's prescription, they are pretty safe. They do not alter the metabolism, they do not alter the growth of the child. Only problem is sometimes very short term, I see some kids having a little bit of behavioral issues, getting a little bit more fussy, more cranky. Those are the problems that I see. Other than that, they're pretty safe.
But those are only short term, right? Only for the duration of the course, but those symptoms resolve once they're done with the medication.
You wouldn't use it on an ongoing basis.
Yeah.
Right. Yeah.
All right. I have one more interesting question. Come winter, patients use humidifiers, vapor ups, and steam inhalation, all these kinds of things. I have noticed patients with history of asthma having worsening of asthma because of the humidifiers and all. So what is your opinion on all these remedies, home remedies that are used?
Okay. Yes.
That's a big question.
They're very widely used. Okay, I'll go one by one. I would say,
Humidifiers.
Yeah, okay, humidifier. So humidifiers, a lot of parents don't know that there are two kinds of humidifiers. There is a cold mist humidifier and warm humidifier. Most commonly available are the warm humidifiers. So we have to pay attention and buy cold mist humidifier. That helps with the breathing a little bit. Especially as I mentioned croup earlier, if it is a croupy cough, the cold air helps with opening up the upper airway. The croup is upper airway blockage. That helps with it. The humidifiers do not help with asthma or asthma attacks. They do not prevent anything.
In fact, make it worse.
We think, the moisture would just make it worse.
Moisture getting trapped,
Humidity,
it can. And a lot of humidifiers, they come with a little container where they do some diffuser, little chemical or gel or capsules in it. If the person inhaling is sensitive to that, sometimes that is like an allergic reaction.
It makes it worse.
And it can make the symptoms worse, and sometimes they can have asthma attack and worsening asthma with the humidifiers. So use cautiously. If there is any family history of asthma or personal history of asthma, I would avoid humidifiers. Also, if at all, if the humidifiers are being used, we have to make sure we are cleaning them properly. Otherwise, the fungi spores can develop.
Mold and breathing and all of that.
Yes,
That's
that's
bad.
another bad
Especially
thing.
in this part of the country, we have valley fever. Already we are sensitive for valley fever, which is a fungal infection. And this will add additional risk.
Do you see a lot of that?
Oh, yeah.
Yeah.
It's very
Yes.
I've known some people that have had valley fever severely, and it's messed them up. It's not.
It
can be really bad.
Yeah. Valley fever is not associated with the humidifiers though.
Yeah.
So
It's a different.
yeah, it's
But
different.
for a kid in particular that has asthma, humidifier is not the way that you want to go.
No.
They would have, if they did anything, it would be more of a nebulizer kind
Right.
of thing.
Yes,
nebulizer, yeah.
nebulizer will help that.
What's your opinion on vapor ups?
Vapor rubs, first of all, they have a lot of essential oils and a lot of other ingredients to help with the smell, but they can be irritant again. When they are applied to the skin directly, they cause some skin reactions. So I would not advise applying directly on the skin. If they had tested like on the daytime when they have access to the medical care and the kid is not getting any reactions with exposure to the vapor inhalation, then it's okay to use vaporizers, maybe on the clothes, on the pillow, on the linen, but not on the skin.
Okay. And about steam inhalation?
Steam inhalation, it's again little tricky. I would not advise any steam inhalation for young children. We see more cases of accidental burns with the hot water than the help from the steam that is intended to use. So advise not to use steam
No
inhalation.
steam inhalation.
And isn't that similar to just a humidifier?
Humidifier doesn't necessarily need to be as hot as steam inhalation. Steam inhalation
It's
is
just hotter.
more hotter.
Yeah.
All right. That's. I don't have any further questions in regarding to this topic.
As, I guess, just as a final look at it, as we go into the summer season, are there particular allergies that people should keep out in front of mind?
Yes, yeah, definitely people are going out more often, so pollen allergies, environmental, seasonal allergies are the more common things. So if somebody is known to have seasonal allergies, make sure you take your antihistamines. The other problem that I usually see is if somebody has allergies, please treat it. Treating it early and aggressively is better rather than waiting and having to treat the complications. The complications, like when it turns into sinusitis or asthma, breathing trouble, that is when we have to use all these steroid medications, nebulizers, and the recovery takes much more longer and needs much more intervention. So better to take antihistamines early on. Also, I do see a lot of parents being concerned about, is it okay to use every day? I mean, the mountain house, it's windy always. So the children are going for sports and we are needing to keep them home. We're not able to let them play outside in the park.
The dust alone could be a lot.
Yeah, because they're worried about these allergies. I would say it's okay. Let them play, let them go out, enjoy the outdoors. It's okay to use antihistamine every day. Even if you give the medicine every day, year long, it is not going to cause any adverse effects for the children. There is no other interactions with majority of the medications. It does not alter with their growth. So it's okay to do that. But if it is more frequent need, definitely seeing immunologist and getting immunotherapy would be more beneficial. So I would say yes, go for antihistamines, not the Benadryl on an everyday basis.
Absolutely.
Not the Benadryl for regular allergy symptoms like congestion, only for
Is there a safe kind of allergy medication they can take on a daily basis? Or if you're having that kind of thing, should you go see your doctor and get it checked out?
Yeah, again, especially every child's health is different, so we have to use only with the doctor's advice. Most common non-sedating antihistamines are cetirizine, loratadine. A lot of people use them off the shelf. Loratadine cannot be given under 2 years of age. Under 2 years of age, any antihistamine should be with the doctor's suggestion only. 2 years and up, okay to use over the counter. Also paying attention to the cough medicine, using age appropriate and the right dosing. That is important too.
And not necessarily a suppressant. I
Not a
guess.
suppressant, yeah. Mostly like
Spectrum.
Expectorant is more safer.
I think we have a question from the audience. What question do you have?
What if you're allergic to one of the prescriptions?
That's
What
a
if
very
you're
good
allergic to
question.
one of the prescriptions? Good
Yes,
question.
It's a very good question.
Very good.
And how do you
Yes.
know? They say don't take it if you're allergic to it. How do you know?
Yeah.
Right?
So yeah, we have often, it's a good question, we often see patients who are allergic to steroids. And steroids are the life-saving medications in cases of allergic reactions. How do you get about them? So do you have any suggestion for those patients like steroids or antihistamine allergies?
Those are the people that I suggest getting immunotherapy. They have to see the immunologist because these are life-saving. And these people need to carry EpiPen. Go see your doctor, always get an EpiPen prescription. I would say get 2 EpiPens, one for the school, one for the home. And EpiPen, it comes, you should get the one with a dual pack, which has 2 syringes in it. One syringe gets broken or something, you have hard time administering it, you always have the second one. Or you administer one and by the time you go fill the second one, you need to have another one handy. That is very important to keep EpiPen handy.
And you would recommend that for families with children that are,
allergies.
yeah,
The
they are,
allergies,
you already
allergies
know
like
that.
asthmatic allergies or food allergies, anything, environmental allergies. And
Not everybody needs to run out and get an EpiPen.
No.
Only with the known history of severe allergic reaction, those are the people who need to.
Usually providers, it comes with it needs a prescription. It requires a prescription, so providers usually make sure that you go to your provider on a regular basis. That's the thing.
Yes.
is very important. And like as you mentioned, the immunotherapy, the infusions and all little advanced treatments for people who are allergic to medicines that prevent mild reactions or people who have severe allergies. This immunotherapy and all need to be done on a consistent basis.
Yes. And any new medication when it is being administered, I would say be cautious for the first at least 2 to 3 doses. Those are the times that you need to monitor. Once after the third dose, if you do not see any reactions, you are very less likely allergic to that medicine.
Yeah. Okay.
That's sound advice. On that note, I guess we will call it. That's really some great information. Thank you so much,
Thank you.
Dr. Chitta, who's a pediatrician with Pearl Pediatrics, and Dr. Chitturi. Thank you for facilitating so many of the questions and
Thank you.
keeping us on track with that, with Assure Primary and Urgent Care here in Mountain House. Thanks for joining us for this episode of Mountain House Health Matters. You can check in with your doctors. I'm sure you can find these guys on Facebook. Like and share and subscribe to this. And if you have comments, please leave those and we'll try to respond to those as well. Have a great day.
Thank
Thank
you,
you.
Bryan.
Thank you.